Welcome. In this video, we demonstrate on a mixed reality simulator a methodical technique for probe handling and steering during side-fired templated transrectal ultrasound prostate biopsy. You will observe a methodical approach for performing a truss prostate biopsy to ensure that the actual biopsies are sampled as close to the template locations as possible, thereby ensuring that all actual biopsies are evenly distributed. A prostate biopsy specimen, or core, is a half cylinder of tissue 18 millimeters long and 1 millimeter in diameter. The shortest distance from the core center to the center of the intended template location target is the error, or deviation. There are 12 virtual template locations in a 12-core prostate biopsy template. In the absence of data about how anterior the template locations are situated, we placed the 12 locations on a plane 7 millimeters away and parallel to the rectal surface of the prostate. Begin by making yourself comfortable by resting your elbow on a firm surface such as a height-adjustable armrest if sitting down, or a Mayo stand if standing up. This will keep the probe stable and prevent inadvertent movement. Your body does not need to face the patient. Hold the truss probe at the proximal end with your thumb, index, and middle fingers for finer control. Insert the probe and identify the prostate and bladder in the ultrasound image. Move the truss probe and place the desired template location of the prostate roughly at the center of the truss display. Only use 3 main types of movements. The first set of movements are push and pull, the second is roll, and the third is yaw. Push, pull, and roll are rough adjustments. Yaw about the yawning plane is for fine adjustments. Keep pitch neutral throughout all of these movements. Insert the probe deeper for base locations and pull the probe out for apex locations. Roll the probe while keeping the pitch neutral to go back and forth between medial, lateral, right, and left sides of the prostate. Use yaw to bring the intended location into the needle path. If the template location is significantly above the needle path, use yaw to move the probe to the left along the incination plane. Remember, moving the probe to the left moves the probe tip to the right because the anus acts as a pivot or fulcrum. The first step is to insert the probe and find the urethra in a mid-sagittal plane. Make the entire urethra appear on the screen along the long axis of the urethra. The pitch of the truss probe is in the neutral position when the entire urethra is visible. Now hold the pitch of the truss probe constantly in the neutral position for the remainder of the procedure. After you find the urethra, do not change the probe pitch by tilting the probe up and down. Rotate the probe always about its long axis using your fingertips like you're returning a screwdriver. The urethra should disappear uniformly when rotating the probe instead of progressively. This indicates that the probe is properly aligned to the prostate. Using the transverse incination plane, rotate the truss probe to determine the appropriate roll angle for medial and lateral locations. Put the desired template location on the truss needle path dotted line using only push, pull, roll, and yaw. After roll, if the biopsy target is significantly above or below the needle path, yaw in plane to bring the biopsy target into the needle path. Yaw by sweeping the probe, with the anus acting as a pivot along the incination plane of the probe, but do not sweep the probe horizontally. Only yaw in plane to adjust the needle path in order to maintain the desired cross-section. Yawing horizontally instead of in plane will lose the desired cross-section. Once satisfied with the ultrasound cross-section, insert the biopsy needle and advance the needle tip 8 millimeters short of the intended target. As a reference, the distance between each dot along the truss needle path is 5 millimeters. Be mindful of the bladder and the maximum excursion in the needle tip when fired. Hold the needle still and fire. After taking each core, go back to finding the urethra to ensure the probe is aligned properly to the prostate before proceeding to the next biopsy target.